This lecture will go over thyroiditis and thyroid cancer. Thyroiditis is an inflammation of the thyroid gland. There are three types: acute, subacute, and chronic. Chronic thyroiditis, Hashimoto's disease, is the most common type. Acute thyroiditis is caused by bacterial invasion of the thyroid gland. Symptoms include pain, neck tenderness, malaise, fever, and dysphagia. It is usually resolved with antibiotic therapy. Subacute thyroiditis results from viral infection of the thyroid gland after a cold or other upper respiratory infection. Symptoms include fever, chills, dysphagia, and muscle and joint pain. Pain can radiate to the ears and jaw. The thyroid gland feels hard and enlarged on palpation. Thyroid function can remain normal, although hyperthyroidism or hypothyroidism may develop. Chronic thyroiditis, also known as Hashimoto's disease, is a common type of hypothyroidism that affects women more often than men. Hashimoto's disease is an autoimmune disorder that is usually triggered by a bacterial or viral infection. The thyroid is invaded by antithyroid antibodies and lymphocytes, causing selective thyroid tissue destruction. When large amounts of the gland are destroyed, serum thyroid hormone levels are low and secretion of TSH is increased. Symptoms of Hashimoto's include dysphagia and painless enlargement of the gland. Diagnosis is based on circulating antithyroid antibodies and a needle biopsy. The patient is given thyroid hormone to prevent hypothyroidism and to suppress TSH secretion, which decreases the size of the thyroid gland. Surgery is needed if the goiter does not respond to thyroid hormone, is disfiguring, or compresses against other structures. The initial sign of thyroid cancer is a single, painless lump or nodule in the thyroid gland. Additional signs and symptoms depend on the presence and location of metastasis or spread of cancer cell. There are 4 different types of thyroid cancer. Papillary carcinoma is the most common type of thyroid cancer and occurs most often in young women. It is a slow-growing tumor that can be present for years before spreading to nearby lymph nodes. When the tumor is confined to the thyroid gland, the chance for cure is good with partial or total thyroidectomy. Follicular carcinoma occurs most often in older adults. It invades blood vessels and spreads to bone and lung tissue. When it adheres to the trachea, neck muscles, great vessels, and skin, dyspnea and dysphagia result. When the tumor involves the recurrent laryngeal nerves, the patient may have a hoarse voice. Medullary carcinoma is most common in patients older than 50. This tumor usually secretes a variety of hormones. Anaplastic carcinoma is a rapidly growing aggressive tumor that invades nearby tissue. Symptoms include stridor, hoarseness, and dysphagia. The hallmark of thyroid cancer is elevated serum thyroglobulin levels. Radiation therapy is used most often for anaplastic carcinoma because this cancer has usually metastasized at diagnosis. The patient is treated with ablative, which destroys the tissue, amounts of radioactive iodine. If spread has occurred to the neck or mediastinum, external radiation is also used. If thyroid cancer does not respond to radioactive iodine, chemotherapy is initiated. For the other types of thyroid cancer, surgery is the treatment of choice. A total thyroidectomy is usually performed with dissection of lymph nodes in the neck if regional lymph nodes are involved. Suppressive doses of thyroid hormone are usually taken for 3 months after surgery. Thyroglobulin levels are monitored after surgery. A rising level indicates probable presence of cancer cells. The patient is hypothyroid after treatment for thyroid cancer. Nursing interventions then focus on teaching him or her about the management of hypothyroidism.